Hello, everyone. My name is Atul Chendge, and I am a public health professional doing my master's in public health from OP Jindal Global University. And I'm associated with environment, technology, and community health consultancy services. And today we have come here to talk about a very interesting but multiple times spoken topic, safe sex practices and HIV management. But why is there need? Why is there need for talking about these things which have already been spoken so many times? It's technically because even though we are aware of these things, we sometimes tend to forget it, and then we get into risky behaviors because हम सबको पता है we all indulge in sex today, tomorrow, day after. Somebody every day we crave sometimes to have sex, or sometimes we are scared of having sex because of all the notions around it, and that takes a toll on ourselves, and that takes a toll on our behavior with other people. And in my opinion, when we are aware of exact proper ways of having safer sex, we can actually perform or indulge in sex in a much better way. And therefore, it becomes very, very important for us to keep on, talking about things like this so that we can live in a very fulfilled sexual life. So, what is safe sex? I personally do not, I personally prefer using the word safer sex because no sex or no way there's no exact way where you'll have 100% safe sex. So, safer sex is basically when you involve measures and precautions which will keep you away from harming yourself or getting into risks of contracting HIV or STIs. There are increasing number of cases in which people are contracting HIV and STIs very rapidly. In our own country, we can see a tremendous increase in the cases of syphilis, and that is a completely that completely changes one's perception of having sex, and that hinders them from engaging in something so beautiful but with a lot of doubts. When we're talking about safe sex, the first and the most important and sought after thing is using of condom. Using of condom not only prevents you from contracting STIs, but also it is used as a contraceptive. So it acts as a barrier. It helps you avoiding any kind of fluid exchange, which is one of the major reasons for contracting of STIs. When we're talking about safer sex, we are actually not going to just dive in कि like हाँ condom लेना है तो मैं कोई भी जाकर उठा कर लेकर आऊँगा. No, it doesn't work that way. When we're talking about condoms, we have to see the best quality of it. We have to look at what is going to suit me. Like most of the time, it is said that latex condoms are the best condoms because they give more pleasure because of their the thicknesses. It has the least thickness, and or I should say it is very thin. Along with that, when latex condoms also goes really well with very different types of lubes, which actually helps in gaining more and more pleasure and less of pain. When it comes to condoms, we basically, this whole notion of size does not matter actually goes out of the window because size does matter. We need condoms, or we need to use condoms which fit perfectly so that it does not come off while having intercourse. So you have to keep all of these things in mind when we're talking about using condoms, because क्या होता है इससे? I get a wrong condom, it comes off easily, and then I stop using condom. I bring a wrong condom, I use a wrong lube on it, and then there is friction, there is breaking, there is allergies, and then I stop using it. What are we doing here? Our first step, which we took after so much of thinking to involve into a safer sex, we're going back to ground zero. So for that, we need to be aware. We have to read, we have to know our body, because everybody's body is different. They will have different reactions to different kind of condoms. And so we need to explore what does my body like the most? What is suiting me the most? And how can I increase pleasure while I'm having sex? There are also a lot of myths that go around when we're talking about condoms. पहले बात तो है कि वो मुझे pleasure नहीं देता. Dude, there are a lot, as I said, there are a lot of condoms that actually give you a lot of pleasure. And अभी तो variety आता है thin, ultra thin with so much of like lube, and it's like so what not. As I said, you need to educate what is available in the market. मैं क्या ले सकता हूँ? Is it affordable to me? And all of those things does come in the picture. But unless and until you don't make up that mind that okay, I'm gonna start actively participating into safer sex, हम वो initiative ही नहीं लेंगे. That is why the first thing we need to start doing is we have to make up that mind कि नहीं, it is risky because I've read about it. It is risky because मैंने देखा है इसका repercussion और मैंने सुना है इसके repercussions. So I am going to take care of myself. Safe sex does not hinder you from, having good sex, but at the same times, it helps you take care of yourself even better because you start grooming yourself, you start knowing yourself more, and then you start appreciating what your body is liking and you start doing it in that fashion. At the same time, there is another myth that कि मैं अगर ओरल सेक्स कर रहा हूँ तो मुझे कॉन्डम लेने की ज़रूरत नहीं है या यूज़ करने की ज़रूरत नहीं है. That is very wrong because there are STIs. There are STIs which actually can transmit through oral sex, like gonorrhea, there is herpes, there is chlamydia. So these STIs can definitely, be passed through oral sex, and then there are other serious repercussions to that. And iske wajah se we have flavored condoms. Some people are using flavored condoms for anal sex. I mean, thoda logic lagao yaar. What is gonna taste you down there? For oral sex, there are flavored condoms, and that is what is going to help you prevent any kind of infection through oral pleasure. However, you need to know how to use a condom properly. On the condom box there are instructions, but आपको वो इतने छोटे छोटे हैंडराइटिंग में नहीं दिख रहा. You can Google. There is enough information online how you can use condoms. You can try it on a banana. You can wearing it before intercourse, so that you know if it is working, it is not working, if it's too tight, too big, everything. And how, I mean, after you're done with that, what are you going to do? You're not just going to remove and throw it like this. No? You'll spill everything everywhere. So what you do is you hold it at the end very tightly, remove it in order to avoid spillage. So these are some precautions that you need to take while using a condom as well. So हमने condoms यूज़ कर लिए, हमने prep भी यूज़ कर लिया, but कहीं ना कहीं what if something goes wrong? What if your condom tears? What if, I mean, मैंने तो condom यूज़ कर लिया but मैंने गलती से 2 condom यूज़ कर लिए, या फिर बिकॉज मुझे लगता है डबल प्रोटेक्शन मिलेगा इसलिए मैंने 2 condom यूज़ कर लिए, एंड अब मुझे नहीं पता क्या करना है, एंड द condom has broken, तो अब मुझे नहीं पता क्या करना है. Firstly, we don't use 2 condoms, we use only 1 condom, because अगर हम 2 condom यूज़ करेंगे, because of the friction between the two, it will break. ठीक है. Secondly, we cannot be 100% sure of our HIV STI status if we do not go testing. Testing, even if you are using a condom, testing even if you're on PrEP, testing regardless of whatever precaution you're taking is very, very important, because testing is the only short way you will come to know about your HIV or your STI status. No one from afar, no one close to you, no one next to you, your boyfriend, yourself, your any partner for that matter, or even you yourself looking in the mirror will never come to know if you have a STI or an HIV unless and until you get tested. It's extremely important to get tested at least twice a year. And if you are very active sexually, then it's always advisable to have your test done every 3 months. It is just for you to know your HIV status, because that will actually help you take care of yourself even better. Another thing that you need to also think when it comes to safer sex is communication. Everyone is like, क्यों किस बात का communication? उससे कैसे safe sex हो रहा है? Safe sex is not only about using things for penetration or before penetration or after penetration. No. There is something called as setting boundaries, and that is a part of the whole communication thing. You need to set your boundaries. You need to adhere or come in, on a mutual ground when it comes to boundaries with your partner, because there are some people who are not into oral sex completely. There are some people who are not into anal sex completely. So when one forces the other or makes another person more, kind of manipulates the other one into doing it, So there could be some chances that the person is still resisting, the body is still resisting, and then even if you're using a condom, it might come out, or because your body is not, completely into it, that person might not respond properly and you might lose your erection. Hence the whole idea कि condom suit nahi kar raha. So communication is going to break all of those barriers. It is going to make you aware what your partner wants. It is going to make you aware of where you need to stop, and it is going to make you aware of your partner's history. When I'm saying about partner's history, it's not ki like to bad name them, but to know, or for you to be aware that okay, this person is sexually active, so I need to take care of myself more because I have called this person, or I'm interested in having sex with this person. So I'll be sure that I use condom. I'll be sure that I see to it that I do not engage in any kind of, condom-less sex. So, or do bareback, or is there any instance where I'm not using condom even for oral sex? These are the things that will be very, very clear after you have that proper communication. Another thing that mostly people forget is that कि अगर हम sex toys use करें तो क्या? Sex toys अगर आप use कर रहे हो तो firstly you have to clean it very very properly. You cannot just like हाँ ठीक है पानी से धो के रख दिया. No, there could be bacteria which will not be washed off just with water. And secondly, when if you're sharing your sex toys with your partner or anybody, it could risk transmission of fluid or any kind of bacteria or virus, so it becomes very dangerous and risky. So to avoid that, what you can do is you can use condoms on the sex toy. Then you'll be like, अरे इसका pleasure कैसे आएगा? Lube use कर लो. Toys are just the same. It is just gonna do what it does the best. Condom is just gonna do what it does the best, act as a barrier. Lube will do what it does the best, using lubricating your parts. So there are these ways. It's just that हमें हमारे दिमाग की वो जो खिड़की है ना थोड़ी सी खोलनी पड़ेगी. Sex in general is never going to be safe with anybody because you do not know their status, HIV status. And when it comes to HIV positive people, it is definitely the case that it is going to be little unsafe or, little risky, because the whole idea that the person is positive. But does that mean that they cannot have sex? No, it doesn't mean that. Does that mean that they cannot have, like, they cannot engage in pleasure of any form? No. Does that mean कि उनके साथ मेक आउट करते ही आपको HIV हो जाएगा? No, it doesn't work that way. Firstly, if you know or if you have a partner who is HIV positive, and if you're not HIV positive, then using of condom is very, very important. Secondly, PrEP is the best solution because PrEP will prevent you from getting HIV, right? Because you have one partner who's HIV positive, you all are aware, if you all are communicating with each other, you all are in a very exclusive relationship. So that is a sure thing that that person will not transmit HIV to you if you're on PrEP and if you're using condom. But if you don't know of their status, then using of condom is very, very important as it is. When we say safe sex with HIV positive, how does that sound? Does it sound safe? तो क्या हम उनके साथ सेक्स नहीं करें? क्या अगर वो पॉजिटिव हो गए तो क्या वो सेक्स नहीं कर सकते? So there are a couple of things. Let's address everything one by one. First and foremost, HIV positive लोग भी safe sex practice कर सकते हैं. आप उनके साथ भी safe sex practice कर सकते हो. They can completely have sex the way they want. They can have a fully, fulfilling sex life, active sex life. And second is that, will it be risky? Yes, there'll be some risk involved. It will be a little more risky than with someone whose HIV status and if they're negative. But what happens with HIV positive people is that when they're on ART medication, these medication brings the level of virus, HIV virus, in their bloodstream to such a stage, to such a level where it doesn't transmit. And that condition is called as U is equals to U, that is undetectable equals untransmittable. So if an HIV positive person is there and his viral load is undetectable, his viral load status is undetectable, then he will not transmit, or they will not transmit it to anybody. So in that aspect, sex is safer with them. But what if you don't know that person's status? Then what do you do? That is why the whole idea of using of condom, being on prep, do using condom and being on prep comes into play to assure complete uh, safety while having sex with random and unknown partners. Even if suppose कल को मेरा पार्टनर पॉजिटिव हो जाता है, if my partner becomes positive, so what do I break up under the pretext कि like now मुझे भी हो जाएगा? That's not true. It doesn't happen that way. During that period you can help your partner get on proper ART therapy, and then they can, when the viral load comes down to undetectable, you are 110% safe to engage with your partner. That you still need to use a condom. You can, and the best way to do that and keep yourself safe in that situation is also to get on prep. So these are some of the ways how you can keep yourself safe while and before, while you're engaging in sex with anybody, be it your partner or with random people, and at the same time pleasure yourself the best possible way you think is good for you. बट अब हमने ये सब कर लिया, ठीक है, हमने कॉन्डम्स यूज़ कर लिए, हम प्रेप पे भी गए हैं, हमने रेगुलर टेस्टिंग भी कर ली, आई एम हैविंग अ कम्प्लीटली ओपन कॉन्वर्जेशन फ्रॉम माई एंड विद द पर्सन आई एम एंगेजिंग विद, बट कहीं ना कहीं कोई ना कोई छोटी सी चूक हो गई. इफ समथिंग गोज रॉन्ग, देन वॉट? टेस्टिंग इज इम्पॉर्टेंट, ठीक है, नेवर फॉरगेट दैट टेस्टिंग इज वेरी वेरी इंपॉर्टेंट. And suppose if your HIV status comes positive, तो क्या करें? What if my HIV status comes positive after my testing? So in this part, let's now let's now start talking about how to manage it, because यही तो बहुत बड़ी scary part है यार. People think HIV हो गया, end of the world. HIV हो गया, I need to die. HIV हो गया, I can't have a family. HIV हो गया, सब अब क्या बोलेंगे? So let's talk about that devil which everyone's scared about, because ये तो लोगों के misconception है, and there is a lot of misinformation here, there is lack of information here, and at the same time there's a lot of stigma around this whole idea, because HIV एक STI होने के कारण, because it is an STI which basically means sexually transmitted infection, द होल टैबू जो हम सेक्स को देते हैं कि सेक्स गलत है इसलिए उससे होने वाली कोई भी चीज़ गलत है अदर देन हैविंग बेबीज, इज गोइंग टू हैव सोसाइटल स्टिग्मा. और इस स्टिग्मा की वजह से हम क्या कर जाते हैं? वी आर स्कैर्ड ऑफ HIV. So instead of getting scared of HIV, let's know what is HIV. Let's know how to deal with your positive status rather than just thinking it's the end of the world. Because let me remind you, it is not. HIV is not the end of the world because it is manageable. Because मैं उसे कंट्रोल कर सकता हूँ. HIV की मेडिसिन अगर मैं खाता हूँ, HIV का अगर मैं HIV पॉजिटिव हो जाता हूँ, आई एम टेकिंग केयर ऑफ माई सेल्फ, आई एम अधेरिंग टू एवरी ट्रीटमेंट which is told to me by my doctor, I'm doing my tests regularly, then HIV will not trouble me. So first things first, you come to know this is the news. What happens? You're scared. You're angry. You're frustrated. You don't know what to do. You don't know who to go for, who to approach, how to approach. You want to cry and run at the same time. You want to, there are some thoughts that you regret doing some things, then somewhere you promise yourself of not engaging in sex at all, somewhere you're blaming yourself, you are looking down upon yourself, you are afraid of telling your friends or the outcome you will face. बहुत सारी चीज़ें होती हैं, बहुत सारे इमोशंस होते हैं, बहुत सारे थॉट्स आते हैं हमारे दिमाग में, and it is okay. You feel angry on yourself. It is okay. बिकॉज हमें पता है कि हम कहीं गलत गए हैं या हमें नहीं पता कि हम कहाँ गलत गए, तो हमें खुद पे गुस्सा आ रहा है, विच इज़ ऑल्सो फाइन. वी आर सैड, ऑफकोर्स HIV हुआ है, who's gonna be happy about it. So there are a lot of things, there are a lot of emotions, and it is very very important that you let yourself process these emotions. You have to let yourself feel these emotions. You have to let yourself experience these emotions, because only then you will have this clear head space कि इसके बाद करना क्या है. क्योंकि अगर आप आपके इमोशन सप्रेस करते गए, इफ यू कीप सप्रेसिंग योर सेल्फ, योर इमोशंस, देन यू आर नॉट हैविंग दैट क्लियर स्पेस कि इसके बाद करना क्या है. यू आर नॉट हैविंग दैट, दैट, हमारा दिमाग शांत नहीं है. Our heart is not quiet. It's not calm. So we are not in that right space of mind to take the right actions. And that is why processing your emotions is very important, as that is the first thing that starts to come up. Second is, once your mind is calm, or to calm your mind, what you need to do is you need to educate yourself. Knowledge here is again power. Throughout, or since the time I started this webinar, I have mentioned this multiple times. Do your research, know yourself better. So now हम बात करेंगे कि like, okay, I got my information, and I am in the right space of mind, and I know now HIV is manageable. But there are some aspects that still goes on. That is, there are some myths that still goes on about HIV, because there are some negative information out there as well. There is misinformation out there as well. Things like, people still say, "अरे यार, HIV हो गया तो इंसान कितना ही जिएगा." A person can live his life completely till he's supposed to be living naturally, when only and only if that person starts ART, starts his medication, adheres to his medication, they can live a normal, healthy, fulfilling life. There is other myth कि अरे यार, HIV हो गया है, अब मैं किसी के साथ बाहर जाके खा नहीं सकता, मैं हाथ कैसे मिलाऊं एंड एवरीथिंग, लोग क्या कहेंगे, एंड मेरे फ्रेंड ने तो ऐसे किया था, उसको मिला था कोई तो लाइक HIV पॉजिटिव, सो माई फ्रेंड जस्ट स्टेड अवे जस्ट टू बी लाइक श्योर, एंड ऑल ऑफ दोज थिंग्स. That is just increasing stigma. That is just increasing discrimination. HIV does not spread by shaking hands. It does not spread by sharing a meal. It doesn't happen that way. What do we do then? We go beyond this narrative. We go beyond the conversation of HIV हुआ तो ये सब होना है. नहीं. अगर आप किसी से बात भी करते हो आपके स्टेटस के बारे में, किसी और के बारे में, लेट्स ट्राई टू चेंज दैट कॉन्वर्जेशन इन अ वेरी पॉजिटिव वे. अगर आपका कोई दोस्त आके कहता है कि अरे यार, तुझे पता है लोग, आई मीन HIV पॉजिटिव लोग ऐसे होते हैं, instead of getting offended or taking it too personally, at that time what we can do is, no, ऐसे नहीं होता. There are these information, there are these websites, you can refer them to NACO website, you can refer them to WHO website, and you can show them कि like information यहाँ है, सही information तो ये है. So when you are in that situation, I personally feel you are also in a place of power, where you know what is correct now. And as I said, HIV पॉजिटिव हुआ, मेडिसिन लेना है, कौन सी मेडिसिन लेना है? क्या मैं पैरासिटामोल लूँगा? नहीं. एंटी रेट्रोवायरल थेरेपी. इट इज़ अ लाइफ लॉन्ग थेरेपी, एंड सम पीपल आर अवेयर ऑफ इट, बट स्टिल दे डोंट चूज, बिकॉज उनको लगता है अरे यार, जिंदगी भर खानी है. तो क्या, अगर हमें कुछ हुआ है तो हमें उसका ख्याल भी तो रखना है. If I want to live a happy normal life, I have to take care of it. I have to take responsibility for it. If suppose somebody gets diabetes, are they going to end their lives by saying नहीं, अभी मैं तो diabetic हो गया हूँ तो मैं अपने इंसुलिन नहीं लूँगा, अपने medication नहीं लूँगा? They are adhering to it. You are not alone. There are a lot of people who are taking chronic medicine or taking medicine which are long term, and HIV is just like that. You have to take it for the rest of your life, but here is the catch. ARTs have benefits. ART increases your immunity, which prevents your body from getting other opportunistic diseases. What are opportunistic diseases? These are diseases basically जो हमें, हमारी जब immunity low हो जाती है, तो these diseases हमारे बॉडी में आने के लिए बहुत जल्दी आ जाती है. फॉर एग्जाम्पल ट्यूबरक्लोसिस. द मोमेंट योर इम्यूनिटी ड्रॉप्स, एंड इफ ट्यूबरक्लोसिस के, अगर किसी को ट्यूबरक्लोसिस है तुम्हारे आसपास, इट्स वेरी इजी फॉर देम टू गेट ट्यूबरक्लोसिस. सो दीज आर द इन्फेक्शंस विच ऐसे पकड़े जाएंगे आपको. सो दैट इज़ वाई ART पे होने से आपकी इम्यूनिटी बढ़ेगी और फिर आपको ये सब इन्फेक्शंस नहीं होंगे. दैट इज़ वन बेनिफिट. Second benefit is that ART reduces the risk of transmitting HIV. So this is where we will, as I said, we will talk about U is equals to U. So ये transmission कम कैसे होगा? मैंने दवाई खा ली तो उससे हो क्या रहा है? So when we are having these medicine, this ART, where basically most of the people are having ART once a day, based on the conversation with their doctors, their advice, and their guidance. So people start ART, and when they are on ART, mostly they take it once in a day based on their fixed timings, and that acts as a what do you say, a daily dose, which helps your body fight the virus inside, which helps your body and your blood to fight this virus to to such an extent where they stop being detectable, which is the state of which we call as being undetectable. So when your viral load, which we say the count of virus in your blood, is so less that it is not detectable under a microscope, under certain tests, which is called as viral load tests, that basically means your viral load is undetectable. And when that is undetectable, the virus is not in the capacity to transmit because वो inactive हो चुका है. So it's basically your ARTs are disarming the capacity of that virus to spread. इससे वो अपने खुद के बॉडी में भी स्प्रेड होना बंद हो जाता है, and it will not be spread to somebody else while having intercourse. So it makes the other person who is HIV positive completely safe to have sex with, because now we have ART, we have this combination of drugs which are so amazing कि वो आपके बॉडी में जाकर on a daily basis वायरस को आपके बिहाफ पे मार रहा है. All you have to do is pop a pill every day and take good care of yourself, which basically means कि अगर मैं HIV positive हुआ तो I have to control my alcohol or stop alcohol, control my smoking or completely stop smoking, and avoid doing drugs. So these are some ways that you have to, bring in your life, because life तो change करनी है, इसके बाद life change होगी. But it is up to you कि आपको इसको किस तरह से change करना है. आप कहोगे कि HIV हो गया, क्या मैं मर जाऊँ? नहीं. बट HIV हो गया, क्या मैं अपना आप का ख्याल रखूँ और अपनी लाइफ और बेटर बनाऊँ? हाँ. And the best example for this is there are athletes out there who are positive. There is an Olympic athlete who is HIV positive, and they are leading a very healthy, satisfying, happy life, and they are winning medals at Olympics. So you have to keep these people as role models or inspirations and take good care of yourself. It's up to us how we look after ourselves after getting positive, and that is very important. And that's why if you include self-care after in your whole routine and your whole what do you say, your practice of life after getting detectable, you are going to change your life for good 180 degrees. Being HIV positive can be very, very difficult in the beginning. And it is actually not a cakewalk for most of the people, or I should say everybody. Because क्या होता है कि it is a very big news. जैसे कोई कुछ बड़ा सा हमारे लाइफ में चेंज आ गया है एंड देयर इज सो मेनी थिंग्स हैपनिंग एट द सेम टाइम कि हम ये भूल जाते हैं कि देर आर पीपल आउट देयर, एंड वी स्टार्ट टू फील कि लाइक शायद हम इसमें अकेले हैं, है ना. बट दैट्स नॉट ट्रू. दैट इज एक्चुअली नॉट ट्रू, बिकॉज देर आर सो मेनी पीपल आउट देयर who are HIV positive. There are so many people out there who know there are their friends or their families to be HIV positive. So you're not the only person. And do not ever feel कि ये मेरे अकेले की जर्नी है, because it's not this thing. आपको ये जानना है कि लाइक अगर मैं HIV पॉजिटिव हूँ तो मैं अभी ART पे भी चला जाऊँगा, मैं सब कर लूँगा, बट समवेयर हैव दिस वॉइड कि मुझे समझने वाला कोई नहीं है. आई डोंट नो हु आई शुड टॉक टू. मेरे फ्रेंड्स हैं, मैं उनसे बात करूँगा. देयर इज दिस वन पर्सन जिससे मैं बात कर सकता हूँ, हु आई कैन कन्फाइड इन. बट what is happening is I don't think they understand me completely. So that's when we, where if you're positive, we talk about building your own network, building your own support system. And that is very, very important. Building your own support system actually helps you to come out of this self-pity, fear, and that phase where you are so uncertain and scared of the unknown. So what are these support system looking like? What are these support system that we're talking about? Firstly, find that one person which you can confide in. वो person could be your best friend. It person could be like your partner if you have. And if you feel that that's not the right time to tell them, it's absolutely okay. It's completely normal, and it's completely up to you. You don't have to tell or disclose your status to anybody if you're not ready. But हमें still support तो चाहिए. Where do I go for support? So there are communities of people living with HIV who you can connect with. And I'm sure you will definitely find people who you resonate with. Because here जो मैं कह रहा हूँ कि आप अकेले नहीं हो, you will actually see आप अकेले नहीं हो. You will see that there are people who are living with HIV for a longer period of time than you. For example, we have this support group in Humsafar Trust, which is called as Sanjeevni, which is for people living with HIV. Where if you go, you will see how people from different backgrounds come together and are sharing their experiences, which is so motivating and which is so it helps you in a way that ठीक है इन्होंने ऐसे मैनेज किया तो मैं भी ऐसे कर सकता हूँ. And not just this organization, but there are many other support groups. For example, I myself, when I came across so many people who are who are looking for these support groups, I myself started a support group for PLHIV people. And that has actually helped a lot of people to come out of that fear, because you see there is this guy out there who is also positive and who's also not told his family. Or if you see that there is this another person out there who is recently positive and you are sailing in the same boat, he emotions se manage kaise kare. So you are actually helping each other manage your emotions. So you get a different kind of support system if you become a part of such community. Next is support चाहिए, but support के साथ हमें थोड़ी सी guidance भी चाहिए. And who better than your own healthcare provider? Become a little more open about your what you're looking for, what kind of help you're looking for from your healthcare provider. Tell your doctors that, I'm not feeling well in my mind, or I'm feeling stressed. What do I do next? They will suggest some kind of therapy to you, or maybe they'll recommend you to join some groups. There is so much of internal, stigma and hatred and everything. And counseling is the one of the best things that will help you come out of it. Seek a counselor. It is very very important. दोस्तों से पूछो कि ये काउंसलर्स कहाँ मिलेंगे, या फिर आप काउंसलर्स को अप्रोच करो वन ऑन वन, उनसे बात करो कि दिस इज़ माई कंडीशन, आई एम लुकिंग फॉर दिस. बी वेरी वोकल. यू डोंट हैव टू बी स्कैर्ड ऑफ एनीथिंग. अब मैंने इतना सब तो बोल दिया है. इट इज़ ऑल कि मैं क्या कर सकता हूँ, ये क्या कर सकता हूँ, पर मैं जाऊँ कहाँ ये सब करने के लिए. मैंने ART भी कर ली, मुझे ART भी रेडी हूँ मैं ART देखने के लिए, बिकॉज दिस वेबिनार इज़ हेल्पिंग मी change my mind about ART. So I'm going for ART. But where am I going for ART? I'm going to ART. Primarily, I would advise for you to go to ART, to a government center. So we have Suraksha clinics. We at government hospitals where you can go and get your HIV test done. We have Suraksha clinic. अगर आपको नहीं जाना है, so there is a Suraksha clinic at Humsafar Trust in Wakola also, where you can go and get your HIV and STI tests done. Government centers, HIV STI tests are absolutely free. You don't have to pay any money for HIV STI test. और ये जो डर है कि अरे यार मेरा स्टेटस बाहर डिस्क्लोज हो जाएगा, नो, इट इज़ नॉट. इट डजंट हैपन दैट वे. एंड अगर आपको पता चलता है आपका डिस्क्लोज हुआ है, यू कैन फाइट अ लीगल बैटल ऑन इट. यू कैन फाइल अ कंप्लेन and there are legal systems in place that will protect you from that. So that is why people don't go that route. किसी के पास इतना टाइम नहीं है आपका डिस्क्लोज करने के लिए, because उसके repercussions बहुत है. So those repercussions are working in your favor. So do not think कि मैं वहाँ जाऊँगा तो कुछ गलत होगा. नहीं. These doctors are equally, or I should say more apt and correct people, because उनके पास proper government information है, they have proper government resources, so they are in the best place to help you, that too for free. So your testings are sorted at the Suraksha clinics in these hospitals. At the same time, if you're positive, you will get help at the ART center. If it's a major hospital, then you will start your medicine there and there itself. If it's not a bigger hospital, if it's a small hospital but it's a government hospital, then they will refer you to a major hospital जहाँ पे आपका ART start होगा. वहाँ पर भी आपको कोई पैसे नहीं देने हैं. The best part about ART in India is that it is for free. And with this, I have somewhere helped you all and to gain some knowledge. And I hope that you spread this knowledge and spark this light out there, because misconception बहुत है, misinformation बहुत है, और बहुत सारा stigma है. Let's help each other. Let's gain this correct, you know, information. Safe sex is hot. Knowledge is the actual foreplay. So now go out and spread the good word, and maybe some good vibes too. Thank you.